great to be here with Dr. Tim Alford to ask a few questions about the practice of medicine in Mississippi and how it's affected by insurance issues. Are the patients that you see in your practice without any insurance any different than those patients with insurance as a group?
Interesting question. This group of patients is much talked about over the past year, and in my estimation have been misunderstood and in some instances, many instances, mischaracterized. In the town where I practice, in Kosciusko, these are people that I see every day. If I go to the grocery store, they're the checkout clerk. If I go to the store, they're a store clerk, for example. They may be taking our children to school on a school bus. They are assisting our teachers in the classroom. They are doing many things in our educational system and in our economy that help undergird our economy. So to say that these people are working poor, I think is somewhat of a misnomer. I think they add to our economy, and if you ask them, many of them would be insulted that you call them poor. So a lot of these people are actually my friends. I see them on a day-to-day basis.
How is the Affordable Care Act actually going to affect these people?
Well, it hasn't worked out too well so far, has it? The effort to give these people insurance has sort of fallen on deaf ears within our own state, and the ability to get these people covered under something has been very frustrating. So what we do in our practices is what we call workarounds. When we see these patients, I know that it's going to take a longer period of time to get them taken care of the way they need. It's harder to get them their medicines. It used to be that pharmaceutical companies left a lot of samples in the office, and we used to be able to give them samples. Now those aren't so easy to come by, so we have to fill out forms, which takes time out of our practice to do those things. There are physicians around the state that I understand and have grown to develop good working relationships with that I know will help take care of these people. And so when we need consultation or specialty help, then that is a fairly closed circuit of physicians that will do that. But it is more time consuming to take care of these people, and it also puts an undue burden on our practice. In our particular practice, we have, I looked at the numbers this morning, anywhere from 5 to 10% of patients present to our clinic have no means of payment. I look across the street at our emergency room, the numbers in the emergency room are 23–24%, which tells you a little bit of something. It tells you that patients are using the emergency room as a default if they cannot get in to see us. We try not to put up a barrier to see these people, but these are proud people, right, and they want to pay their bills.
And Dr. Alford, you were saying that people in your practice without insurance frequently require workarounds by the physicians to get them the care that they need. What does this have to do with this whole issue of the emergency room, so where so many of these folks end up?
A lot of these people are working. Usually if somebody's working, they care about themselves and they're proud, and a lot of them don't want to have a bill that builds up in our clinic. So they default to the emergency room because they know that's where they can get care and they won't be asked to pay, okay? So the emergency room is not the best place for people to get their primary care, of course.
Why is that?
Depending on...
Why is the emergency room not a good place for primary care? I mean, we've heard that everybody in Mississippi has insurance. You can always go to the emergency room. We've heard that said.
The emergency room is a place for emergencies. And the emphasis in the emergency room is to deal with emergent situations. You do not have time as an emergency room physician, and I function in that capacity quite a bit, to educate, spend time to try to help people get their medicines properly, to make sure they understand how to take their medicines properly, and to follow up by phone call if need be to make sure they're getting their medicines properly. If you go to most any emergency room in the state, they're pretty congested. Waiting rooms are overflowing, and a lot of that is because patients, that's their only option, is to go there. In our case, in Kosciusko, we have almost a 22-23% of those patients that present have no means of payment. So it's the patient part of the ledger that we're all concerned about, that these people are not getting the appropriate care in their appropriate setting, but it also places an undue burden on our hospital because of the law of the land, the healthcare law that we here in the South refer to as Obamacare. Because of that law, the payments to hospitals began drying up 4 years ago that help offset losses for uncompensated care.
So what does that mean in your community in particular?
Well, our local hospital board approached our county board of supervisors last week for the first time in its history to ask for a line of credit. So
that means they're not going to be able to make their payroll, or what?
One would think, yes, that we're getting close to the break point. It is putting rural hospitals across our state under great stress in a state that considers itself a rural state. In the state of Mississippi, we have 20 counties that are considered 100% rural. We've got 57 counties that are considered 50% rural, 50% urban. There's no question we're a rural state. And so a lot of the care, if you say that care should be delivered at a local level, this is placing many of our rural hospital systems in great jeopardy.
And so the emergency room piece then is, it's a stopgap measure. It's not meant to provide longitudinal care. That's what you've said. And you only have time just to fix the acute problem. And if people don't have access to the longitudinal thing, like you said, the primary care, then they don't get these all addressed. Is that the point?
It's a very substandard way to get care. It is not the care that these people need. So many of these people have chronic illnesses that need attention. They need somebody to sit down and sort out their many problems, make sure medicines aren't interacting with one another. All of that takes time. And it's a serious matter. It's a serious business when you sit down with these people, that many of them are sicker than your average Joe because they're not able to get the primary care in the first place.
Dr. Alford, I can tell how passionate you are about taking care of these people. And we really appreciate you taking time to tell us about what's really happening out there. Thank you.
Thank you, Rick.
What about the preventive medicine and public health component of the ACA?
Primary care, preventive medicine is the best bang for your buck. Value is what we have to have in the system now. And the law for the first time places an emphasis there.